One thing I wanted to explore with you was a hot topic these days is the role of insurance companies and their impact on healthcare. I know from my practice, experience, I started this practice saying I'm just going to take insurance and provide really high quality care. Realized that I could deliver the high quality care, but I couldn't make it work financially in this.
Right.
I'm guessing your wife is a similar experience. I mean, she has a membership model type, psychiatric practice as well. Do you think that AI could help improve that role? Because people are paying a lot of money for their insurance. I understand their frustration when they're like, wait, I'm paying $800 to $3,000 a month for my healthcare insurance, and then I'm still not getting high quality care.
Right.
Like I have to pay extra to get good quality, to get access. How do you think AI could help with getting insurance to deliver the results people are looking for in their healthcare?
So I'm going to do my very best to stay neutral and try to give a neutral answer that's not taking sides, because of course this is a controversial topic. But really what you're asking is this concept of the payer-provider collaboration. And yes, AI can and will and is already starting to improve some of this relationship in certain domains and fronts. So when we look at like risk adjustment on the healthcare side, basically meaning which patients are at higher risk of hospitalization, are going to have a higher cost, might even be at higher risk of death. How do we allocate resources to them and get better reimbursement for them because they need it, right? Everybody has a different care need. So leveraging AI to make sure we have the right documented code for certain patients will allow for better reimbursement from that. So in cases like that, where you're identifying the right patient that has the specific needs at the time that they need it, it benefits everyone. The insurance company is happy because they're very targeted with who they're spending more money on and which ones don't need more. Additionally, they're going to prevent hospitalizations and high-cost events by giving extra TLC to certain types of patients. But they're not in the clinic with you, so they don't know. So if we're not capturing things right and sending it to them right, they might not respond right. And that's where traditionally we've seen a lot of this clash. Well, you should have done that visit quicker, or I'm not going to give you as much payment for that because the patient had this diagnosis. So as AI gets better at detecting very small nuances that will lead to bad things, then everyone benefits because you're going to get what you need. You'll get to spend better time and get better reimbursement on the time you're spending. And the insurance company is happier because they know which patients have those needs.
Yeah, brilliant.